Hi, I'm back to talk about chapter 24. And this is something you've seen, the Z codes, which deal with health status. In other words, all the other reasons that people can come in for an encounter in the healthcare setting. Covers participation in clinical trials, pre-employment health appraisals, and it also covers pertinent history that even though the patient presently doesn't have the condition, we still want to capture that since it can impact their care. Let's have a closer look. Okay, these are the famous Z codes, Z00 through Z99, cover such things as personal history of cancer, family history of cancer, and any other reason that somebody may come in to the healthcare setting. Also covers outcomes of delivery and newborns. These are codes that really address important health statuses, but aren't necessarily an illness. We can consider these diagnosis codes, right? But they're not necessarily active disease. And if a procedure is performed, of course, we're going to have a corresponding procedure. In other words, procedures being something you would capture when the provider is doing something on behalf of the patient. These codes are used to capture the reason for the encounter besides a disease or an injury. That's the diagnosis. So you can think of these as kind of like the chief complaint or the reason that somebody's coming in to the healthcare setting. Here's some examples, Z00 through Z13. When I worked in clinical research, we had a lot of Z00.6 for participation in clinical trials. We also have Z20 through Z29, persons with potential health hazards related to communicable diseases, something we're hearing a lot of lately. And then Z30 through Z39, people that are encountering health services in circumstances related to reproduction, such as procreative management, what have you. There's an instructional note under category Z01, encounter for other specified examination without complaint. So this is why somebody's coming in for an exam, right? Let's take a closer look at that. So you can see here under Z01, this is a special exam, covers such things as eye exams, what have you. And there's some excludes one notes. You see excludes examination for administrative purposes, suspected conditions, lab, and so on. You see the eye exams, failed vision screening, dental exams, all these things. Another example is Z85, personal history of malignant neoplasm, right? And this is an important one to get around because there's a difference in reimbursement, whether it's on for most fee schedules in a fee for setting service setting or the HCC reimbursement, definitely differences between personal history of malignant neoplasm and active cancer. We also want to make sure that we code any alcohol use or dependence, exposure to tobacco, history of nicotine dependence, or any other conditions that are listed under category Z08, history personal of malignant neoplasm. History is the main term, personal, and then malignant neoplasm. There's a list of coding guidelines, and these are greatly summarized in your textbook, and they're very, very helpful. They're also in the front of chapter 21, and are available on the CDC website where all the other guidelines are. These guidelines cover how to use Z codes in the healthcare setting. And the Z codes, think of it as the reason that somebody's coming in for an encounter without necessarily being sick. This could be contacts, exposures, vaccinations, status. So in other words, if somebody's a carrier of a disease, family history, personal history, screening, another good main term, observation, aftercare, follow-up, donor. So somebody who's donating blood at the blood bank, this is a type of code you would use. Counseling, encounters for OB and reproductive services, newborn, well baby appointments, administrative exams, and many others. There's a great chart in your book, and I want to bring special attention to it. So please pay special attention to what I'm about to show you. Please pay special attention to this chart, table 24.1. These are the keys to the kingdom. These are the main terms you will use in the alphabetic index to locate these Z codes. And some of them you've already seen before. These are things: pregnancy. Note that there's also dependence, problem, exposure, healthy, history, personal love. We can also have history, family, newborn, and others. Here's some other examples of Z codes. Immunization not carried out, Z28. Encounter for prophylactic surgery, Z40. Z53, persons encountering healthcare services for specific procedures and treatment not carried out. Z72, problems related to lifestyle. Z76.5, malingerer. Z91.1, patient non-compliant with medical treatment or regimen. And Z91.83, wandering in diseases classified elsewhere. There are specific Z codes and they're non-specific. These are used in outpatient settings for limited instances. So some examples where Z codes can be the principal or first listed diagnosis, for example, Z00, encounter for general exam without complaint, suspected or reported diagnosis, except Z00.6. Let's take a quick look at that. And then as we can see, we have right here, Z00, encounter for general exam without a specific complaint. So we have a reminder for the fourth character. And then when we get here, we get told to have, no, fourth's not good enough. We need a fifth character. And here's an example. Encounter for general adult medical exam without abnormal findings. Z00.01, right below it, encounter for general adult exam with abnormal findings. And then right next door is what we referenced earlier and what I'm familiar with here, which is the encounter for normal comparison and control in a clinical research program. So in other words, if somebody participates in a clinical trial, they come in, they get a lab draw or another exam and are evaluated in a clinical trial, that's the diagnosis code you would use. We also have a whole bunch of new codes related to social determinants of health. These are things that are coding potential health hazards that are related to socioeconomic or psychosocial circumstances. And a lot of times we see, particularly in the emergency room setting, documentation that indicates this type of social information. These codes are only assigned on the basis of providers' documentation. When we say provider, we're talking about anybody who's related with the care of the patient. Could be a social worker, could be a physician, what have you. And again, as mentioned, code assignment can be based on medical record documentation from the clinician, not necessarily the patient's healthcare provider. This could involve a social worker, community health worker, case manager, nurse care manager, what have you. Patient self-reported documentation may be used to assign these codes for social determinants of health, as long as the patient's self-reported information is confirmed and signed off by a clinician or provider. There's specific guidelines for this that are summarized in your text, and you can also see them in your code books under section 1.b.114. We also have this type of breakdown for all the health status codes related to social determinants of health. This includes Z55, problems related to education and literacy, Z56, problems related to employment and unemployment, risk factors, and others. That's all I have for you right now. Come back as we'll finish our lecture and discussion on health status codes.